Welcome to our clinical lesson. We are now at the exciting time where we can discuss clinical, where you've now wrapped up your lecture portion of the class, and now when you finish your lab portion, it will be time to go to clinical, where we get to work with real live patients and you really get to see the difference that you get to make in these patients' lives. In this lesson, we're going to be covering what to expect in clinical, some of the clinical rules, some key safety reminders, what to expect during mealtime while at clinical, going over isolation rooms and reminders, talking about where you can get your supplies and where you put dirty supplies. We're also going to cover things like showers and requirements to be eligible for clinical, as well as some clinical location information. First, we're going to start with what to expect at clinical. As a reminder, we are going in to a facility that has real live actual patients that we're going to be helping. This is super exciting because once again, you get to see the difference you get to make in patients' lives as a CNA. So when we're working with patients, the ultimate goal is that we're always treating them like they are our own loved ones. If this was my mom, my dad, my grandma, my grandpa, how would I be treating and caring for this patient, right? Same exact thing for every patient that we work with. We should be treating the same as if they are our loved one. So that should always be first and foremost in the top of your mind as you're caring for these patients. You'll be assisting patients with anything and everything that they need that will fall under the job of a CNA, right? So from bed baths and showers to transfers, vital signs, meals, toileting, incontinence care, mouth care, and everything in between, any type of activity of daily living that they need. You're going to be working with several different patients throughout your clinical experience. The variety of patients that you work with will make you a well-rounded CNA. It's going to give you a ton of experience with patients with different abilities and disabilities. Our goal at clinical is to get you as much experience as possible during your clinical time. And part of that responsibility is going to fall on you to put in the effort to always stay busy. There's always something to do. There's always a patient that needs something. And so that's the expectation, is that you guys remain busy as best as possible throughout your clinical experience. How this will look is you will be paired with at least one other student, and then you will also be paired with a CNA. You're going to be paired with a CNA, and your job will be the same hallway or set of patients that the CNA has are the ones that you will help care for. Now, as instructors, we cannot be with each student the entire time, right? We're going to have to jump from student to assist you. That's why we also pair you with a CNA and another student to make sure there's always somebody there with you to help you feel a little bit more comfortable and confident, okay? Studying at home, making sure you thoroughly listen to the lectures, completed the online class, made sure you read the book, you fully participated in lab, made sure you got enough practice so you feel as comfortable and confident as you can, right? Ultimately, we know it's very uncomfortable the first time you go into working with a live patient, right? Your confidence isn't necessarily where you want it to be, and it's just anytime you're doing something new, it can be a little bit more difficult. So keep that in mind. Do your best to get out of your comfort zone. Walk in the room with confidence. The more confidence you have, the more confident the patient is going to be. This just gives you a little look into what it's going to be like when you go into clinical, what to sort of expect, what it's going to look like, etc. Next, we're going to touch base on our clinical rules. Clinical is obviously super important. We're working with real patients, like I've mentioned. There's going to be family members and staff members as well there. And it's going to be super important that we follow these rules to make sure we're providing the best experience for you and for the patients that we're taking care of. First of all, it's highly recommended, actually required, that you bring paper and pen. This should just be like a piece of scrap paper or a small notebook that can fit in your pocket. That way you can take notes. For example, you'll be asked to take vital signs where you're at clinical to make sure that you have a place to write them down, notes on your patients, so you can always go back to refer to those when you're giving care or before you give care. If your hair is longer than shoulder length, you need to make sure it's worn up in a ponytail. Your purple scrubs must be worn, and you must be on time, and no absences are allowed for clinical. Absolutely no cell phones can be out on the floor. I always recommend to students that you just keep them in the conference room that we meet in at whatever location you're at. You will be given one warning out on the floor if your cell phone is out on the floor. If you see it a second time, you'll be asked to leave. Once again, we are visitors in a facility that is allowing us to come in to have this experience for our students, and we have to follow their rules. Obviously, safety is our number one priority. I cannot stress this enough. It is imperative that you follow all safety guidelines. That should be your number one thought every single time you're working with a patient. If you're unsure if something is safe, you should immediately stop, make sure the patient is in a safe spot, and then grab the CNA, a staff member, or any of your clinical instructors as well. Safety is always our number one priority. We want to make sure we're never ever taking any shortcuts when it comes to safety, and we're doing everything we can to make sure our patients are as safe as possible. We need to remain professional and respectful at all times, making sure that we have a positive attitude, we're using good manners, and we're completely professional when interacting not only with patients, but with visitors, family members, and staff members as well. Quality care is obviously super important. We want to make sure, like I mentioned in the previous slide, that we're taking care of these patients as if they were our own loved ones. Quality care is what we're looking for. Obviously, following directions and staying on task is important, so making sure that we're staying as busy as possible. When you're given a task, that you follow through on that task and you do as you're told by your instructors. Staying busy there is always something to do. No matter how many students we have at clinical, there is always something that needs to be done. As a CNA, we wear multiple hats. Patient care is always at the forefront, something that should always take priority over everything else. However, things like charting, stocking rooms, emptying trash, and hampers are some of the many things that we can do to help make sure everything runs smoothly throughout our shift. Other things we can do are make beds when patients are out of the bed, maybe they're at therapy or they're at an appointment or just up and ready for a meal. We can make their beds. It's always nice for them to have their beds made, something to come back to. We can practice vital signs. We can do hand and nail care. We can answer call lights. Even if we can't necessarily answer or help them when we answer the call light, going in and seeing what they need, that attention and quickness to their call light can make a big difference in their day. And a lot of times, to be honest, they need small things like, can you hand me my phone? Can you get this for me? Something that we can truly help them for. If it's something you can't help them with, it's no problem. Let them know you're in training and that you'll be back with a CNA to help them. And either the instructor or the CNA can come back to help them when they're available. Once again, we can stock rooms. There's many things that we can do. Another great thing you can do, especially when you're new to healthcare, is just sit down with a patient and speak to them. Developing those communication and interpersonal skills is one of the best things you can do. Learning how to interact and carry conversation with people maybe you don't have a ton in common with or you don't know where to start. This will be a great experience for you to do that. Plus, a lot of these patients, unfortunately, don't always have visitors. So that extra companionship of us being able to sit down and talk to them goes a long way, and really you can see the difference that you make. And honestly, I learn a lot from patients and hearing about their life story, the things they've been through, the things they've done, where they're going from there, etc. So those are many of the things that you can do to stay busy. So even when things slow down, these are some things we want you to look at. We'll teach you how to use the vital cards while you're at clinical as well, and that's something that you can practice as well. With any questions and concerns, we ask that you come to clinical instructors. If it's something about a patient and you're working with your CNA, please go to your CNA. But we try to avoid going to additional staff like nursing, administrators, housekeeping, etc. Because when there's a lot of students there, it can be a little overwhelming when they have multiple students coming up to them. So outside of your CNA, unless it's an emergency, we ask that you try to come to your clinical instructor with questions. Once again, you make your clinical experience. We're going to provide you a fantastic facility. We go to all 5-star facilities who have great facilities. They're clean, they provide great quality care to their patients, they're attentive, and they're always excited for us to be there. But a huge part of your clinical experience is how much you're willing to put in the effort to get as much experience as you want as well. So please make sure you jump and take yourself out of that comfort zone and jump in and do as much as you can with as many patients as you can. All right. Have confidence is extremely important. Like I talked about, when you're confident, the patient's going to be confident. Okay. We're not going to put you in a situation where you're going to be unsafe in helping a patient, right? So make sure you have confidence when you go in there. All right. We wouldn't be letting you in clinical if we didn't have confidence in you. As a reminder, any unprofessional, inappropriate behavior will not be tolerated, and you'll be asked to leave clinical and unable to finish class. Once again, we are visitors in their facility. We're working with real live patients who have loved ones, and we need to make sure we're being professional, providing, quality care, we're being safe, and we have appropriate behavior at all times with a positive attitude. There will be no warnings on this. We are very strict at clinical, so just want to bring it up here as a reminder. As we mentioned, safety is our number one priority here. So we made a whole slide regarding safety and some key points we want you to remember to make sure you're always being safe when you're working with patients at clinical. The very first and most important rule when it comes to safety is you will never transfer a patient while at clinical with us without a staff member or instructor there with you. We want you to do all the transfers. You need to get experience doing transfers. A 1-person assist, a 2-person assist, a Hoyer, a sit-to-stand, a slide board, or any other type of transfer that might be there. However, when you're new, a transfer is an easy time where things can go wrong and injuries can occur, not only to the patient, but to yourself as well. So it's imperative that we, first of all, know their transfer status. And we don't ask a patient what their transfer status is. We look at the care plan. Unfortunately, patients don't always, know their correct transfer status. They sometimes think they can do more than what they actually can, or they lie to you, unfortunately, or some just are unaware. Maybe they have memory loss or other things going on. So we always have to have a staff member to check the care plan to make sure we know what their actual transfer status is in the care plan. So we're following all safety procedures here. Once again, no matter how much a patient tells you what their transfer status is, how much they tell you they have to go to the bathroom, they can't wait, etc., we have to make sure we have a staff member or their instructor with you, okay? Then we're going to make sure that we have those during the whole transfer. And that's just to make sure we have a second set of eyes, to make sure we have the gait belt on appropriately, to make sure that we have all the other safety checks, that the wheels are locked on the bed in the wheelchair if we're using wheelchair, that they have non-grip footwear, their feet are flat. Those types of things are all being handled. Sometimes when you're new, it's easy to forget something. And once again, we don't want any injuries to occur to the patient or you. So once again, we're not transferring patients without a staff member or an instructor there with you unless you're given permission from an instructor to move forward with a transfer without any supervision, okay? This is super important. I want to make sure everybody fully understands this, okay? Another important part is that anytime we are transferring a patient, they should always have non-skid footwear on. Their feet should be flat on the ground. The wheels need to be locked on all devices you are transferring them to or from. We need to make sure that we're checking if they're attached to any tubing, right? Or any type of devices. Do they have an IV? Do they have a feeding tube? Do they have a catheter? Or any other type of tubing? We need to make sure those are coming with us, that we're not yanking or pulling on anything. We always need to make sure that we have a good grip on the gait belt and that the patient has a gait belt on. The only time it'd be okay for a patient not to have a gait belt on is if their transfer status is independent. Outside of that, supervision, 1-person, 2-person, a gait belt must be on the patient no matter what when you are transferring them. Even if you see other staff members transferring without a gait belt, it is your responsibility to make sure that you are using a gait belt. Once again, same thing goes with a Hoyer lift and a sit-to-stand lift. We need to make sure that a staff member is with you. If you are ambulating a patient, Make sure you never let go of a gait belt, and same thing with a transfer, right? We are new to these patients. We don't necessarily know how well they transfer outside of their transfer status. Sometimes people just have bad days where they're a little bit weaker, lose balance easily. So it's important anytime we're transferring or ambulating a patient that our hand is on the gait belt, we have a good grip on the gait belt, and we are in a good position to help them as we're walking them, transferring them, etc. Anytime we are rolling a patient, we make sure we roll them towards us to make sure they are a safe distance from the edge of the bed as well. All right. Exit protocol is super important, making sure that we always lower the bed to a safe level and make sure patients have their call light in their hand and that it's easily accessible for them. If there's ever anything you are unsure of, always ask, right? It's always better to err on the side of caution. I would always rather you err on the side of caution than do something and either yourself or a patient get hurt. These are the main safety key reminders that I want you guys to make sure you fully understand. If you have any questions, please reach out immediately. I'm happy to answer any questions you guys have on this. Next, we are going to be covering mealtime. Now, every facility is a little bit different than the next on how mealtime works, the time that the food comes out, how they pass the food. Some have it set up where some patients are in the dining room, some get their food in their bedrooms. It's up to them on how they want it. Some do it, everybody's in the dining room. Some do it where everybody's in their bedrooms and they eat there. So it really can vary from facility to facility. However, there's one thing that's going to remain the same, and that's the items that you see on this PowerPoint slide right here. First of all, every time somebody gets food in a facility, there will always be a meal ticket. That meal ticket is super important for safety. We always have to check the meal ticket for their name, so the name of the patient, first and last name. Surprisingly, some people can have the same first and last name, so we always want to also check the room number, and we always want to verify and identify that we have the correct patient because some people can have the same names. We want to also look at the texture of the food. Are they on a regular texture? Are they on pureed or mechanical soft? These are super important items to check. So before we hand them the food, we're actually physically looking at the food to make sure the texture matches what's on the plate. For example, mechanical soft diets, think of something that's easy to chew. A salad is not easy to chew. It requires a lot of chewing. People that are on mechanical soft typically cannot have salad. They're also not going to have a chicken breast on their plate, but they will have ground chicken because it's easier to chew. Pureed is, I want you to think it's been through a blender. It's hard to even tell what it is. All right, almost looks like soup in a sense. That's what pureed is going to be, and regular texture is what you and I typically always eat. So making sure all of that matches. It's always going to have fluid thickness as well. So that's going to be thin. It could be nectar thick, honey thick. There's a lot of different varieties of thickness. So you want to make sure that that matches what drinks are on their tray or plate as well. These are super important because if we give them the wrong type of texture of food or the wrong type of thickness of fluids, it could cause them to aspirate or to choke, and obviously very unsafe for them. So we are sort of that second line of defense. The kitchen can be putting together 100 plus trays at one sitting. They are human beings and may make mistakes. So we are that second line of defense to make sure we're triple checking everything before we hand it to the patient. Another huge area that's super important to check is going to be the allergy section. This will be on the meal ticket. And you're going to make sure if there are allergies, you're going to check everything on the plate. If you are unsure if what they are allergic to could potentially be in one of the dishes, then what you need to do is you need to go to the kitchen to check and make sure that that item's not on there. This happens often where unfortunately an allergy is missed, it ends up on the plate, and it can get served if we don't do our due diligence. Recently at clinical, I was helping students pass a tray, and we had a patient that was allergic to walnuts. We're going through, we're looking at the ticket, and then we're checking all the food on the plate. We see the allergy is walnuts on the meal ticket. We're going through, and there was chicken and broccoli, and I forget what, I think there was potatoes. And then they had a dessert, which was carrot cake, and it had some nuts on top. Now, I couldn't really tell, or we couldn't really tell what type of nuts because they were sort of mashed up. We went and checked with the kitchen, and sure enough, it was walnuts. If we would have handed that to the patient, they could have gone in anaphylactic shock, and that could have been really bad. So us doing our due diligence, triple checking that meal ticket with allergies and looking at everything on the tray, help prevent something bad from happening. So it happens more frequently than you think. Like I mentioned, also making sure you have the correct patient. Several of the facilities that we go to have 2 patients in the same room. Making sure you have the correct patient is super important. Some patients have the same name. Making sure you're verifying that patient by first and last name is also important, and the room number if able to. If a patient is sleeping, we always wake them up to let them know that they have warm food there. If they choose to go back to sleep, that is completely on them, but we need to at least let them know they have warm food and it's available for them. We always need to make sure patients are in a safe eating position, so they should be sitting upright. So when we're handing the food and getting it set up for them, we just want to make sure we sit them up or at least help adjust them if they need help, if they can't do it themselves. Remember, our goal is always independence, so if they can do it on their own, we'll allow them to adjust, but just making sure you're helping in any way there. We want to make sure we're offering any assistance in cutting up food, opening packets, or setting up the tray in any way that they need. Typically speaking, I always ask my patients, what can I help you with, right? If they're able to communicate, then I will follow the directions. If they're struggling with communication or unable to communicate, then I will start setting up as best as I can and then let them sort of start moving around. And then I can notice, oh, they're having a hard time with that packet. Let me help with that. A lot of times things that require fine motor skills, like opening sauce packets, sometimes pop cans, can be a little bit more difficult for them. So that's where I really try to pay attention. Some meal tickets will tell you if they need further assistance. For example, if they're one-on-one supervision, that will be on the meal ticket. And that means we cannot leave the food with them, that we have to remain with them during their meal for safety reasons. Some of them might need full assistance with feeding, and some of them just might need some supervision because maybe they've choked in the past or they tend to eat fast, or sometimes we call it pocketing food, where they'll start storing food almost like a chipmunk in their cheek, and then what happens is they accidentally swallow it all at once and then potentially choke. Some of the meal tickets might say cut up meat. So if the kitchen didn't cut up the meats, it's our responsibility to make sure before we leave that their food is all cut up. We want to make sure all items are within reach, and especially if they have an affected side, making sure that they can reach with their unaffected side. And then we are good to leave as long as it doesn't say one-on-one supervision on the meal tickets. Once again, sometimes these meals will come out on trays on a cart down each hallway, and you just pass the tray to the room. Sometimes you're passing trays in a dining room, and sometimes it's a combination of the two. It's a little bit different in each facility, and that's where, when you're on your first day, you guys will get a little orientation of what that looks like between your CNA and your instructors as well. Now on to isolation rooms. So isolation rooms will exist at Clinical in a variety of forms. You've heard in our previous lectures about different types of isolation rooms, from contact to droplet and so on and so forth. It's going to be super important that you review how to properly don and doff PPE. So remember how to properly put on and take off your personal protective equipment like gown, gloves, mask, eyewear, etc. Okay? There's different types of isolation rooms. So once again, please make sure that you're reviewing what contact, airborne, droplet require when you're going in. There is also a new type of isolation room that they've created recently in the past several months in long-term care specifically. And that is called enhanced precautions. And what that is this is for patients that have some type of opening to their body. It could be an IV, it could be a tube, it could be a PICC line, it could be a catheter, it could be a wound from a surgical incision or a pressure ulcer or a fall. Those patients are at a higher risk for infection because of that opening into the body. Because of that, what the state is required is that these facilities put them on enhanced barrier precautions. And what that just means is that we have to put gown and gloves on when we go in to do certain tasks with that patient. It's not every time we go in the room, but if we're doing personal care like toileting or brief changes or bathing, we have to have our PPE on, and that is to protect the patient because of their increased risk of infection. On the door in the facilities, you will see a sign that typically has a stop sign on it, and then it will have the type of precautions. For example, contact precautions or enhanced barrier precautions. If it says enhanced barrier precautions, it is also going to list the times or the skills or tasks that require you to put on PPE. So just please make sure that you're looking and following those to protect not only the patient, but yourself and other patients and families as well. The PPE sign will be on the outside of the door along with the equipment as well. Typically, it's either on like a door hanger, it's hanging on the outside of the door, or there's like a little plastic 3-drawer or 4-drawer organizer on the outside that will have all the equipment that you need. As a reminder, we always put our PPE equipment on before we enter the room, making sure we sanitize. Outside before we enter, we put our equipment on. We go in and keep our equipment on during the entire time we're helping the patient. And then we go to the doorway. We never step into the hallway with our PPE equipment on. We're still in the room. We remove our PPE equipment properly, then wash our hands and exit the room. I think that's the biggest mistake that I see most students make is walking out into the hallway. Remember, we do not want to bring that bacteria into the hallway. We are trying to prevent the spread of infection. So once again, please make sure you're reviewing how to properly put on and take off your PPE and the different type of isolation rooms so you're fully prepared when you go to clinical and know how to correctly enter and exit those rooms. Next, I briefly just want to touch base on what clean utility and soiled utility rooms are at these facilities. So a little bit different than our lab setting, our clean utility rooms at most facilities are going to have all your clean supplies. So most rooms are going to have basins and briefs and wipes and soaps and things of that nature already in the room, unless one, they're a new admit, or they ran out of those things and nobody restocked it. If they've run out, they're a new admit, you need to get something new. The clean utility room typically is going to have all of your clean linen and all your clean supplies. Once again, I told you the things the patients will already have in their room. So when you go to do a Bed Bath & Clinical, you shouldn't have to grab basins. You shouldn't have to grab briefs or wipes or soap or lotion. That should all be in the room unless it wasn't restocked or they're brand new admit. All of your linen is also found in the clean utility rooms. You will not find additional linen in the bedrooms or in their rooms unless somebody just put it there. It should not be stored in the room. Once items leave the clean utility room, they're going to be considered dirty. So we can never go back and say we didn't use them and put them back in the clean utility room. When they leave the clean utility room, they are considered dirty. They should be put in a bag and put into the soiled utility room, which I'll go over that here in a few. As a friendly reminder, make sure you're always carrying your linen away from your scrubs as well. When you get to your facility, whether it be the instructor or the CNA, you will get a quick little tour and be showing where the clean utility and soiled utility rooms are. Typically, most of those have some sort of code on the door, and you'll be given that as well. Now with the soiled utility room, sort of similar to the clean utility room, it's going to be its own room. It's going to have a code typically to get into the door. The soiled utility room is where we're going to put all of our trash and our linen. Now, what is important to know is that personal clothing and linen is handled differently at each facility. Pretty standard is that when you go in the soiled utility room, there's going to be 2 bins. There's going to be a bin for trash and a bin for clothing or linen. Please make sure that you're placing any trash in the trash bin, any linen in the linen bin, and you're paying attention between the two. We don't want to be throwing out clothing or linen. We don't want to be putting trash in with the linen bin. Now, how it typically works is most rooms are not going to have a hamper that we just sort of keep putting stuff in till it gets full and leave. We typically bring out our linen with us whenever we're done. So say we're giving a bed bath or a shower, we're going to put linen in the bag and we're going to bring the bag out with us when we're complete. When we're changing a brief or we're putting anything in the trash, I always empty the trash bag. I never leave a dirty brief, especially in the trash can, and make sure you put a new trash bag in. Some places may have specific colored bags for trash, some for linen. So just make sure wherever you're at, the CNA and instructor or one of them will go over how they specifically handle linen and personal clothing at that facility. Some places have a laundry mesh bag for personal clothing for the patients. Some have a hamper in the room. Some families take care of the clothing and they want things done a certain way. So once again, just touch base with your CNA or the instructor and they'll go over how it's handled at the facility you're going to. All right. Typically speaking, if you need to find a trash bag or a specific bag that you need, if they have specific colors, a linen bag, a clothing laundry mesh bag for the patient, a lot of times those are going to be found in the soiled utility room. So just check there first. Always ask your instructor or CNA, they can help as well. We always make sure that when we leave for the day that we've taken all of the trash out in each room too. So just a quick little overview of the soiled utility room and sort of an understanding of how it works in the real world, just with the understanding that each facility is a little bit different on how they typically handle this. All right, one of the biggest questions that we get is how to shower a patient. You are going to be doing showers in clinical most likely, doing a combination of hopefully bed baths and showers, but sometimes it just depends on the patients. If you get set up with a shower, I want to go over how we help a patient with a shower, sort of from start to end. First of all, before we even get the patient ready to get in the shower, we always want to sort of set up the shower first. And what that looks like is most facilities, the rooms will have a shower in it. Some places will have actual shower rooms as well, if they don't have them in the individual rooms, and not every room might have a shower room. What I do is wherever they're taking their shower, if they're going to be in a shower chair or on a bench, we'll sort of differentiate this. Some people like the bench. Some people like to be sitting in a shower chair. What I typically do, if they're in a bench, I put one towel down on the bench. If they're in a chair, you don't need to put a towel down on the chair. Then what I do is I'll put one towel down on the floor. Make sure you don't, the floor in the shower, make sure you don't cover the drain. I put one towel on the floor outside of the shower because what happens is inherently when you're helping somebody with a shower or they're even helping themselves, these showers just have a very small lip. There's not really anything to prevent the water from coming out. And so it helps keep the floor dry by putting that towel on the outside of the shower on the floor. I always put washcloths within reach, typically around the grab bar. I'll put a handful so it's easy for the patient to grab or for us to grab as we're helping clean them. Remember, each patient is different. They're going to have their own unique needs. Some are going to be able to do the shower fairly independently, and some are going to be totally dependent and need us to help with everything. And then we're going to have some that are in between that. So just be aware that each person has their own unique needs, but that's how I start with setting up each shower. When it comes to transferring the patient to the shower, as a reminder, anytime somebody has a gate belt on, we always have to have clothing beneath the gate belt. So you'll need to make sure that they have at least a shirt on when you're using a gate belt to transfer them in. And as a reminder, one of our key safety points is that you need to have a CNA or an instructor or some staff member in there with you when you're doing the transfer, because we need to know what the transfer status is and a second set of eyes to make sure that all safety is being followed for the transfers, especially in and out of showers. It gets slippery and it can be dangerous. Those grab bars in the shower and bathroom are going to be your best friend in helping patients get in and out of the shower and on and off the toilet as well. I always, if they're in a wheelchair, I pull them right up to the grab bars in the shower and have them as best as they can grab the grab bar to help stand up, making sure you're using the gate belt, the wheels are locked, and then I set them down. Once I stand them up, I'll do is I'll move that wheelchair out of the way if they have a wheelchair, help pivot them. And then if they have pants or underwear or a brief on, I'm going to pull that off and set them down on the bench. And then I take the gate belt off and then I take the shirt off at that point and then get the water going and help starting with the shower. All right. It's easiest to take the pants and the underwear or brief or whatever they may have on the bottom off. So you don't have to stand them up, sit them down, stand them up, sit them down. So it's sort of easiest to do during the transfer aspect, but there's not necessarily one right way to do this as long as all safety aspects. Once again, you could probably watch 5 CNAs do a shower or a bed bath and they're going to do it completely different. As long as they're giving quality care, you're making sure you're being fully safe and you're respecting the patient's wishes as long as safety is our number one priority, then that's what matters. I'm just giving you a breakdown of how I typically do it to make sure these things are being followed. Once they're all undressed, what I do is I get the shower going, have the resident or the patient test the temperature, and then I start washing like I were to wash myself in the shower, right? Keep things as simple as possible. I start at the head. I'd go shampoo, conditioner if they want it. Sometimes it's all in one, and wash the face, work my way down the body to the chest, the arms, the abdomen, the legs, the peri area, the back, etc. So work your way head to toe, allowing them to do as much as they can and you jumping in wherever needed. One thing that's super important is I want to make sure everybody understands is that we cannot leave the patient alone in the shower unless in the care plan it says that they are independent with their shower. So that's something we need to always be sure that we're not leaving the patient. If they want privacy and they can do it on their own, we can close the curtain to allow them to do that, but we still have to be in the shower room with them so that way we can hear what's going on. If they need help or if they were to try to get up, we're there to help make sure everything's safe and they don't fall. Every patient, once again, is going to be different. Some are going to need more assistance than others, and it's really about communication at that point. Asking them what they need help with, where they're able to do on their own, and sometimes it's even making sure they're getting the areas the best they can. When it comes to transferring out of the shower, once again, we have to have something under the gate belt. So I always fully dry them in the shower or have them dry themselves, depending on their abilities, right? And then I'll put a shirt on and I will put the gate belts on over that. I will then put their underwear or their brief on with their pants. And then when we stand them up, we can help slide them up and get them in the wheelchair or the walker or however it is that they transfer out according to their care plan. And just being very, very aware that the shower area is going to be slippery and that we should do everything we can to dry off the shower floor, the outside of the shower, so there's no slippery spots for the patient as they're walking. They need to have some sort of non-skid footwear on as well. That would be the socks with the grips, slippers that have grips on the bottom, shoes, etc. So always keeping safety is our number one priority. But a little bit of a breakdown on how I typically address a shower and help a patient with a shower. Once again, there are multiple ways to do this, not necessarily one better than the other, but as long as we're being safe, respectful of the patient, and providing quality care, that's what matters most. As a reminder, I want to go over what makes you eligible to enter clinical. What do you need to have done to make sure that you are good to go? In order to enter clinical, you must have completed all of your online work. So the online course must be fully complete. You must have an average of 75% or better in your online coursework. All lab days must be completed prior to entering clinical. So you must be present and on time for all lab days and checked off by your instructor. Your instructor will be doing this through lab as you guys are demonstrating and practicing skills. That's why it's so important that you're there for all days and they must be fully completed. You must have a negative TB test within the last year. At this current time, you must have a COVID vaccination or exemption. Always follow your welcome letter, which will have the requirements. This could change as time goes on. And then we need a copy of your government ID. That can be a state identification, a driver's license, passport, etc. We just need some form of government ID for you on file. Once you've met all these requirements, then you are eligible to enter clinical. Lastly, clinical location. This is probably the biggest question we get often is, where are we going for clinical? We have a variety of clinical partners at each of our locations, and that's just to make sure that we can be providing the best experience possible for our students. A lot of things come into play when we're choosing a clinical site for a specific class. The number of students we have, the census of the clinical location, their availability and willingness to have us during that time period, state inspections, etc. So every class is different and may have a different clinical location based on that class. So you will be given your clinical location during your last day of lab. So please make sure that you write down that information. You take a picture. We always put it on the board for you guys, and you know exactly where you're going and ask any questions because every class is a little bit different. And once again, you will receive your clinical location during your last day of lab. We are super excited for you to begin clinical. This is my favorite part of the class, and it is so exciting and fun to watch you guys go in to start caring for patients, see the smile on your face as you start making a difference in the patient's day, and really to see you guys blossom from lab to clinical as we round out our course. If you have any questions on anything about the online course, any of the clinical lesson that you've just listened to here, please don't hesitate to reach out. You can always reach me directly at kfort@h2health.com. Thank you, and we look forward to having you in clinical.